I'm called Hajarah, and I work for Lady Mami's Bureau, which is a sex work-led organization. I'm a sex worker, and I'm also the new elected Uganda Country Coordinating Mechanism Key Population Representative and an alternative. As a person, I've been working for a community-based led organization. We've really done a lot of community health and policy advocacy. So still we had a lot of challenges. But the journey has been not been easy, and it's not easy, I can tell you that, because we work in an environment which has stigma and discrimination for the key populations, an environment which has a lot of violations concerning the key populations, and the community where we work and live from is not also friendly. But again, we know when it comes to advocacy for our communities, it's something we have to do, because the more we keep quiet about issues concerning us and issues affecting our communities, that's the more we can get hurt. We've been doing this at community level. One, we've been strengthening communities to be able to demand for health services in their respective communities, and we've empowered many. We've reached an extent of training peer educators in different key populations. In the approach we've been using has been the peer-to-peer approach, to see that in our respective organizations where we work from, we work closely with peer educators, and we know peer educators work at the community level, and we know they reach many key populations. So we've been using the peer-to-peer model to see that the services can reach to the last key populations at the ground. And again, we've been doing a lot of sensitization and creating awareness on issues of key populations. We've been sensitizing the health service providers, sensitizing police, sensitizing culture, and also religious leaders to understand the health needs of key populations, and also to understand that violations against key populations increases HIV in our communities. But also we've done many advocacy activities. I can talk about the community scorecard, because we know as key populations we have a minimum package at every government health facility, and we know our government has a budget for the key populations concerning our health issues. So what we've been doing is to go to government health facilities to see that we can score them and hold them accountable of the services that we are entitled to get, which are free and friendly. By doing that activity, one, we've been strengthening the working relationship between the key populations and the health facilities, health service providers. Then two, we wanted to know the gaps in the health provision, so that when we are doing advocacy, we can know exactly what are those gaps in every government health facility. That has really helped us to know exactly what we need to advocate for. And again, even advocating at national level. At national level, we've done many activities, we've done many campaigns concerning key population health related issues. We've done many radio and talk shows concerning the key population's health issues. The world has committed to end HIV epidemic by 2020, and even Uganda, we have to do that. But as key populations, we also want to contribute to the UNAIDS, to the UNAIDS 1990 strategy. And when you see HIV among our communities, the HIV prevalence is very high among the key populations. And when you talk about statistics, you can see that the general population, this is under the AIDS indicator survey, the general population is 7.3% HIV prevalences. Then sex workers have 33 to 36%. The MSM has 12 to 2. The MSM has 13 0.2%. Then the Fisher Fox has 22 to 25%, whereas the Trackers has 25 to 32%, and the uniformed personnel has 10% to 18%. You can see that the HIV prevalence is high in the communities of key populations. And why is it high? It's because we don't have meaningful engagement, and we have laws and policies that are targeting the key populations, especially the LGBTI community and also sex workers. Sexual minorities face a lot of laws and punitive laws and policies. They are unfriendly to our communities, and they also add a lot to the HIV prevalences in the communities where we come from. I talked about meaningful engagement. I think key populations is a vulnerable community which has been left behind by many players in Uganda, including our own government. Because if you put laws and policies in place which are targeting and discriminating the key populations, especially the Fisher Fox, especially the sex workers and also the LGBTI community and the injecting drug users, so it means you are increasing HIV among them. And when you talk about contributing to the 1990 without bringing the key populations on board, then we are doing nothing, because we've seen that when it comes to the HIV prevalences, we have the highest percentage of HIV in the country. So for me, my call is to see that key populations, we want strategic positioning, because we are the key populations, we are the people, we are the solution, not the problem when it comes to HIV fight in the country. Let key populations sit on every level, at every level, at every platform. We don't want people to discuss about our issues without us. We want to be there, work with us. Let's discuss together, engage us at levels of planning, levels of implementation, levels of monitoring and evaluation, to see that every project targeting key populations, every program targeting key populations is learned and it's led by key populations themselves. That's how you can get to know what our health needs. And for me, I think the best of that can be that if key populations can take lead in the key population health program, then that can really help us to decrease the HIV prevalences and fight HIV together. The responsibility of representing the key populations on the Uganda country coordinating mechanism, I think for me it's something I've been doing. That's the work we've been doing in our respective organizations, and to me, I know this is my responsibility, but not only as someone who is representing key populations, it's a responsibility for all key populations in Uganda, because for me, I am a messenger, I'm an echo to the voiceless, and I know I will push our agenda. I'll talk about issues affecting key populations. I'll talk about our needs. I'll talk about global fund money to go directly to key population organizations, to key population organizing, to see that the key population themselves can utilize this money and fight HIV in the country. Because we know we have many activities as key populations we have to do once we have the monies and once we have the platform where we can raise issues concerning us. Because for me, I'll do what we call direct representation. And what do I mean by direct representation? I know for me to fully represent all key populations, it means I have to work directly with them. Within the key populations now, we are very organized. We have systems and structures within us. We have the most at-risk populations network, which is a network for all key populations networks and organizations. And within, we have the MAPS network, and we have also the networks of all key populations. We have the sexual minorities, which is a network for the LGBTI community. We have the Uganda network of sex work-led organizations, which is a network for sex workers. We have the Uganda network of fisher folks, the UFCA. We have UFCA, which is a network of all fishing communities. We have ATUGU and UTALDA, which are networks of all long distance truck drivers. We have Uganda Harm Reduction Network, which is a network for inject people who are using drugs. And we have what have I left? We have I think those are the
UNESCO,
7 networks. I mentioned UNESCO, okay. Yes, the sex work network. We have networks within us, and every network has member organizations which subscribe to it. We have the Oversight Committee, which is working closely with the MAPS network. The Oversight Committee oversees and gives guidance to the MAPS network about every activity and all the monies which comes into the network for key populations. So we have systems and structures in place. For me to fully represent the key populations, it means I have to work with them. Decisions have to come with them. Everything I have to push there, the health needs, the health concerns, whatever, even if it's about advocacy for key populations, I have to work directly with them because I'm a messenger. They will tell me exactly they want to hear from me. I'm not there to represent myself, but I'm there to represent them, and I will get the issues from them so that I can represent it. I can represent them at that high level. The Uganda Country Coordinating Mechanism is a board body, and it complies of the MALT and the MALT. It complies of the public sector and non-public sector constituencies, and it has different representatives, including the key populations and development partners and the government and people living and affected by the 3 diseases, which is HIV, TB, and malaria. For me, I think CCM is a strategic platform. And I know as key populations with my colleague Moses Chimbugwe, this is a platform where we have to raise our issues, where we have to articulate our issues at the national level. Tell people what key populations want. Tell people not to plan for us, but to raise issues of key populations. And I think we had already key populations representing us at that level, and I know they have done a lot of great work, and we know we cannot take their work for granted, and we are going to start from where they have actually ended, to see that we can see what they have been doing, and also do a lot of consultation from the former CCM members for key populations, do a lot of consultation from different stakeholders and partners who are working closely with the key populations, and also utilize all opportunities we can get, because we know we are going to meet different people, very useful people to the key populations. And I know we have academias under CCM. We are going to utilize all resources. We are going to utilize guidance, consultation from all these people. But we are going to consult our community as well to see that we can get equal representation there, and we want to see that we are not going to raise issues, and issues will just remain in the boardroom, whereas where we will be want those issues to be put into consideration so that our communities can benefit in everything that we discuss for them. Like I said, we have networks, and every network has different key populations, member organizations. So for me to reach the grassroots key populations, it means I have to work through their networks. And once I work through their networks, I know networks have different organizations, and those organizations have membership, and those membership are the key populations at the grassroots level. When I work with them, I know this system and structure will enable me to reach to the last key population at the grassroots.
Yeah, we know you as an outspoken or renowned sex work activist. Do you think you're ready to handle, because I think much of your emphasis has been much on sex workers, do you think you're ready to now tackle issues of fisher folks, tackle issues of transgender men?
Thank you so much.
Yes.
Of course, I will say yes.
Okay.
Because I was selected and elected by all those constituencies you are mentioning. Because I'm a sex worker, and my clients have been the long distance truck drivers and also the fisher folks. And I'm a bisexual woman. I'm a bisexual. That means I also fall under the LGBTI community, and I'm a drug user. So it means I also fit in the Uganda Harm Reduction Network. So I'm Hajarah, but I'm many things. And I know it was the key populations who knew I have potential, and they knew I've been doing this work. And I know I'm not the best, because I know we have very many good key populations. They are educated, they have potential, they have really served this community with a lot of passion, with a lot of commitment, with their time, their mind and body and their heart and all that. But it wasn't a mistake for me to choose me to represent them as the alternative representative, and I know I won't let them down. And I won't promise them a lot, but I'll be doing exactly what we've been doing to see that we can push our agenda, to see that we can bring money from the Global Fund, and we see that we can give the Global Fund guidance, and we oversee the Global Fund monies for key populations. And we want that money to go in the right arms, and we want that money to benefit our members. And how will the Global Fund benefit the key populations? We want to see that we reduce the HIV prevalences in key populations, because we know we had many people who have been lying to work with us, and we have many who have been supporting us and helping the key populations, but again they have been doing something for us without us. So this is the time now to see that we can bring all stakeholders on board, to bring all people who want to work with us, but we want them to hear still from us. The two representatives of CCM, which are Chikonyogo Chivumbi and Judah Evare, they are community people. We've been working with them, and we will still work with them, because we know they have the experience and they have the skills of working with the CCM. And when we know, we will consult them, we will work with them, we will borrow their expertise, and they will tell us exactly what they have been doing there. Because as key populations, we need many strategies to see that our voices can also be heard, and actions can be made, not to talk about issues, and issues can just be left for people to hear them and just leave them there. But I know with their support, and support of our networks, and support of key populations, rights advocates, I know, like I said, we will need many people for us to be able to represent them, So we'll do a lot of consultation, we'll have many meetings, we'll have many dialogues with different key populations to see that we can represent them with knowledge on their priorities, health priority needs that they will offer us. My message to the key populations: let's continue working together, because we know when we are together we can win, and when we are divided we can fall. I know we come from different perspectives as key populations, but let's continue working together. Let's bring that solidarity, and let's fight HIV together. I know if we work together as key populations, then we will win. That's the message I have for key populations. And for our implementing partners, I know we have many implementing partners, but I also think it's high time, because I know they do a lot of good work for key populations, but many times they don't consult us, they don't engage us, they design programs for us, they plan for us, they implement on our behalf. I think it's high time now for our good implementing partners, because we know as key populations there are many things we cannot do without you. We need them, and you want to work with them, but we need let them bring us on the same table and discuss together and find for solutions together. For the implementing partner, my message is meaningful involvement of key populations in everything you do for us. We need you to engage us. Let us be meaningfully involved. I know when we share, when we discuss together, when we share our issues together, we can find solutions together. Engage us. And I call for our government, because I know our government knows key populations. We are there and we are here to stay. The truth is, we are here, and this is our country, and we are not going anywhere. And under the key populations, we have special groups like the LGBTI community and sex workers, especially the LGBTI community. We have many laws and policies. Then if you talk about reducing HIV and ending HIV in Uganda by 2020, and you have these laws and policies, especially the laws that target, key populations, especially the LGBT community and also sex workers community. We have the HIV Prevention and Control Act, which has many clauses which hinders our access to medical services, like mandatory testing, like disclosure of results. For the government to reduce HIV by 2020, for me, my call is work with key populations, revise or remove the laws that discriminate them, because those laws and policies that target the key populations, especially the LGBTI community and sex workers, first of all, they fuel stigma and discrimination in our communities, and that leads to many violations in the of LGBTI community and also sex workers. They lead to high stigma and discrimination in health settings. They lead to people to work undercover. We are the people, like I said, we are the key populations, we are the people. We are not the problem, but we are the solution if we want us to fight HIV together in the country, remove the laws that discriminate us. Lastly, I can talk about the culture and the religious leaders. I know that religious leaders preach hate, not love, but the key populations, we are your children, some of us are mothers, we are sisters, we are brothers, we are friends, we are neighbors, and we are Uganda citizens. So for our government, love us, just don't hate us. Don't bring those laws which also increases HIV. The one we are talking about now, the one we want to increase by 2020. love LGBTI communities, sex workers, other communities like fisher folks. I know even the injected drug users have very strong laws which hinders their access to medical services. Just to work with the key populations and remove all those barriers. We remove the barriers in the health settings, barriers in the laws and policies, barriers in forcing the policymakers to pass those laws because of their positions. But we know there are some who are us and who are supporting us. But because of those laws, their hands are also closed. Yeah.
Thank you, Hajarah. Thank you.